Here's my reference point, yes? So my body can either be here or here. It cannot be here because this is the new pattern you're going to create. So I want to get my body in line with the angle. I have two choices here. Now it just so happens I have a preference over one. When I am doing the anterior elevation, posterior depression, I want it. No, I need to scoot to the middle because I can't. My back's bad. I can't reach that far. There you go. Then I might prefer to be here. Okay, for this one. Okay. Or if you prefer, you can be here. I don't care as long as you're in this diagonal. It's your preference choice. Okay? As long as I get down here and here. For this diagonal, I like here. Because I feel like I can control it. I can watch what's happening with the arm. I can stabilize the arm here if it's flopping forward. My personal favorite for anterior elevation, posterior depression is to be behind the patient. The other pattern was called posterior elevation, anterior depression. So it's in this direction. So we're going to come this way and this way. Keep your arm straight. Boom. Boom. See the diagonal? Okay? That's what I'm going to try to create. Again, my choices, I can be here because my body's in that plane. Or I could be here, facing that way. Not facing this way. So that I can be here. I like this because I can trap the arm between the hip and my arm. I can get here and here. So for this pattern, me personally, Todd speaking, likes to be here. If you look at the textbook from P&F guys who developed this, they usually are at the head of the table for both patterns. I can't do it both ways and get what I want. So my preference is for this pattern to be here, for the other pattern to be over there. Okay? I still follow the rules. Coming in here. The sequence is going to look like that. If we're going to, everybody keeps saying, well, when do I use it, and how do I progress, and what's the point of all this, right? So we have a patient who's come in, let's say they're post-shoulder decompression, decompression surgery in here. And so we're not going to move it, it's a little sore to move the shoulder yet, but the scapula we noticed looked pretty awful in our exam. And so I want to begin to work on scapula. And I know that their patterning is really terrible. Okay? So what I'm going to do now is I want to assess the patterns, the two patterns, and I'm going to start with this one because I'm here. Okay? No other reason than that. So the first thing I do is I am going to move the patient. I'm not going to tell her what pattern it is yet because I want to assess if there's any tightness limiting that motion. Just like we did for scapular joint mobility. So I'm going to come in here, I'm going to pull down, feel that, make an assessment whether I think that's tight or not. Pretty good there. It feels a little tight to me right there. So if I felt tight here, should I go into rhythmic initiation yet? Why not? Because I can't produce the full pattern. So until I get this moving very well, I cannot train a full pattern. So what are my choices now in P&F lingo to work on this tight upper trap area? Hold and relax or contract relax. So if I'm going to do hold relax, I'm going to stretch it up. Don't help me. Relax. Thank you for playing. You got to get your patient to relax. Stretch it here. Don't let me move you. Hold me. Hold there. Meet my resistance. A little less. A little less. A little less. Hercules. 2, 3, 4, 5, 6. Relax it. Completely relax. Now, stay relaxed. That's what they want to do. As soon as you pull, they want to contract again. Stop. Relax. Pull it from there. Hold. 2, 3, 4, 5, 6. Relax it. Stay relaxed. Don't move. Don't do anything yet. Stay relaxed. Nice. Hold there. Great. 2, 3, 4, 5, 6. Relax it. Relax. And stretch. Back down. That's better. Okay? Other choice. Choice number 2 is And I have two sub-choices here to make. I can do direct, which means I'm going to use autogenic, same muscle to relax. I'm going to turn it on to get it to relax. So I'm going to let her pull up. We're going to pull up in this direction right there. Ready? Pull up, pull, pull, pull. Nice. Keep going, keep going. Now relax it. Relax. And pull up, pull. Very nice. Relax. Relax. Autogenic inhibition. And do that a couple times. If I want reciprocal, my thumb's where the lat is. I'm going to try to get this direction. If I need to show it to you real quick, we're going to go this way. Okay? Pull down. Pull, 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 pull. Good. Relax now. Stretch. Push here again. Push, 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 push. Relax. Good. Push. Relax. Stretch. Reciprocal inhibition. Okay? We retest. Okay, so now we're going to do the whole pattern now because I think I can get a whole pattern from her. This is going to be up. This is going to be down. This is going to be up. And this is going to be down. Help me out just a little bit. Get it right there. And then right here. As she gets better at it, I start to take some pressure off to see what she can produce on her own. If I need to, I give a little resistance to get what I want. Just like Sherry said. So now we got a nice pattern going. So all we're going to do, this is the pattern. We're just going to do this for a while. This is nice. She's reproducing it. Starting to get a little sloppy. Relax because you see it go to the ear. Stop. Back here just a little bit more. In here. So right there. To here. Pull up. Pull down. Pull up. Pull down. Pull up. And down. And up. And down. Better. If that's all we did today, we got a nice pattern out of it. I can then, if I want to start beginning to strengthen now, I have a couple choices. I can do agonist reversal, or it'd be concentric up, concentric down. So if I want that, we'll start now, pull up, and push, 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 push. I'm giving resistance now, up, 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 resist. Concentric, concentric. If I thought the lat was a little weak here, I could do concentric down and then eccentric. So the command here is pull down, pull, pull, pull. Now slowly let it out, slowly let it out, slowly let it out. And I'm giving a resistance. Okay? Pull real tight. Slowly let it out, slowly let it out, slowly let it out, slowly let it out, slowly let it out. Slow, slow, or slow. Whatever you want. Slow, 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 slow. Okay? So we just did concentric, eccentric for this guy. Because, remember, we like that depression or something like that. That's because that's what you saw as a problem child. I could have chosen to work in this direction. Does that make sense? That's how you're going to employ all of those. Now, if I found a weakness in the range, what choice can I throw in while I'm doing it?
The twitch.
A little quick stretch. Well, we don't call it twitch, we call it quick stretch, but I like you're thinking. So as we come down, I thought it was a little weak right here. She's coming down. Little quick stretch right there, quick, right here, right here. I'm poking the muscle here. Okay? Peds therapists hit their patients. It's the same idea. They're stimulating the muscle fibers that way. So it's a little quick stretch in there. It's not a lot, just enough to say, I want this muscle right here. You hear me? That's kind of what you're telling the muscle.
To initiate your motion too, like in the very beginning.